Okay, I'm back. Like I was saying, I take two capsules of this wild salmon oil, and that's about 2,000 milligrams. But when you're in full-fledged wasting, you should take um, at least two of the protein shakes a day with at least four of these 1,000 milligram salmon oil capsules. Salmon oil is the best. I was thinking of krill oil or halibut or cod or whatever, but I think salmon is the best for this sort of problem. Well, it has some fish oils, I don't know. Anyway, it worked for me. And I stopped losing weight and I gained the weight back, and which is really great, and I'm strong. And I was really, what the wasting does is it's not getting rid of fat. You're not losing fat. You're losing the muscle that's connected to the skeleton. And that is very serious. I mean, if you're going to lose muscle, that's the worst muscle you can lose. And that's why some obese people with cancer die of wasting, because you can't tell, you can't see that they actually they're burning off the muscle against their skeleton. So it's really important to take care of that, and the doctors aren't going to tell you about it. You're going to have to, you'll know yourself. Now, to know the difference between the tumors eating up your nutrients and energy, I think your tumor has to be a certain size. Anything over 5 or 6 centimeters. But again, I'm not a doctor, so don't quote me. But it has to be a certain size and certain intensity in order to start eating up your muscles. Now, when you're talking about the chemotherapy in the stomach lining, then that you'll know that right away. You just won't be able to eat anything. And thankfully, I came across this study on PubMed, and it was talking about how this sort of supplementation, the protein shakes and the salmon oil or fish oil, helped a lot with the wasting, or to get to decrease the wasting and increase weight gain and muscle, skeletal muscle gain. Now that's really important. Moving on to another side effect. Nausea. Nausea is, if I don't have my Emend, this is like a 3-tablet pack, you see? And they give you 125 for the first day. You take that in the morning of the first day of chemo, especially if it's carboplatin. And then the second day you take the 80 milligram, and the third day you take the 80 milligram. And they also give you some other anti-nauseants, but this one works better. If I don't have this, I'll be sick all night. Like, I need it. So, and it's not nice to be nauseous and actively vomiting all night long. I mean, chemo's bad enough. Now, there's also, I want to actually, if anybody's interested, I went almost a year not knowing how to take these tablets out. I was actually trying to take them out that way, and I didn't even notice the bottom. There's instructions too, and there's a diagram like how to do this, and I didn't even look. And there's a tab here. I haven't taken mine this morning. I was waiting to show you how to do this. There's a tab here that you fold along, and see what I did there? Folded. And then you pull the tab out like so. It's supposed to come out. There, see, comes out, and that frees up the tablets. And then you take out your tablet, well, this way. Oh, I just broke it, shoot. Oh, okay. Well, I just broke my capsule full of amend. That's not good. Anyway, okay. It was a bit rough there. Oh, shoot. Okay, well,